term for a cavity. According to Sonia DeCanadina, Karma Daniela DeMario, dental caries prevalence is highest among children. Preventative habits such as brushing teeth twice a day with fluoride toothpaste under parent surveillance is the most efficient and low-cost method to preventing dental caries. So here's a picture for the cavity. A lot of cavities. So the tooth decay is damage that occurs when bacteria in your mouth make acids that eat away at the tooth. So the reason that I chose dental hygiene as a career is first, they have a flexible schedule, so they can work a part-time, have only 3 days a week, or have a full-time schedule, work 5 days a week, or they could have 2 part-time, work for 2 separate offices and make it a full-time schedule. So I probably will do a part-time schedule and have time to be with my family more of the week and still make, you know, a good amount of salary, only 3 days a week. The pay around Texas is around $75,000 a year for a dental hygienist, $35 an hour average, which is pretty good. And that's one of the main reasons why I chose this career. Also, they work by themselves in the office for the most part. So the patient comes in and they get their teeth cleaned from the hygienist, but then the doctor comes in afterwards and makes sure they don't have any cavities, and then just goes over the dental hygienist's work. So they pretty much work by themselves during the day. They don't have to follow the dentist around like the assistants do. Because I worked as an assistant for 3 years, so I've done all that, followed him around, you know, all that time, so I would rather be more independent. The main job of the dental hygienist is to educate the patients. So first, I have started educating myself before school by observing a hygienist. I had to have 40 hours of observation work for one of the schools. Most of them were only 16 hours that were required, but I did do the 40 hours. So I've learned a lot about the field just by watching different dental hygienists in the area. I'm applying to 5 different programs. Oklahoma and UAMS in Little Rock has a program. Also TJC, Tyler Junior College in Tyler, Texas, and Collin County College in McKinney, and then Tarrant County College in Fort Worth. So there's a lot of different programs that are around the area, but I will have to move. It's not anything that's within driving distance. One thing that I will learn there is how to teach the patient properly how to brush and preventative maintenance on their teeth to prevent any type of decay. Electric toothbrushes are the main thing that patients need to prevent decay. I have a few here that I'll show you, but first, this is how to brush correctly. So the correct angle is 45 degrees at the margin of where your tooth meets your gums. That's where you need to aim to brush all around your mouth so that you're sure to get your gums, not just the flat surface on the front of your teeth. The inner surface is something that a lot of people really miss because you do have salivary glands under your tongue, so the inner surface on the bottom of your teeth is somewhere that you really get a lot of plaque buildup. So you have to angle the toothbrush in there so that you can really get that area, because a lot of people miss that. Also, there's some salivary glands in your cheeks that cause the plaque buildup around the back of your mouth so that you really got to get back there, it's just harder. But the sonic vibrations on electric toothbrushes really help with that. So this is a Sonicare toothbrush. They're the best in my opinion. They range a little bit over $100, but it's well worth it. That's what I have. I've used them for over 10 years. So I really recommend those. They also have this UV cleanser for the head that you stick it in there and it cleans the head of your toothbrush. This one is, it's kind of a knockoff of the Sonicare, but they're a lot cheaper. They're about $30, and then the heads are significantly cheaper than the Sonicare. And the Sonicares are, you get 6 heads for like $40. But on this knockoff brand, they're $6 per head, and it's like a subscription, so they mail them to you. So that one's new on the market, but they're doing pretty well. And then this is the Oral-B. I would not recommend those because they don't have the sonic vibrations, so you just put like a regular battery in them. These other two actually have a charger. But the Oral-B takes a AA battery, but they don't have sonic vibrations, so they just twist really kind of fast, but not as fast as the sonic vibrations. But I mean, they are better than just a regular toothbrush, so if anything, I mean, you could do that, but I would not recommend it as much as for Sonicare. Dental caries have a negative impact on related quality of life. So this chart kind of shows what dental caries can impact as far as your health. Main ones would be the dental decay, bad breath, tooth loss, and gum disease. One thing that dental hygienists do learn in school is how to detect oral cancers. So I'm really excited to learn more about that. So with children, I read a study that they are missing school because of their teeth. So they have a toothache, and it's, you know, it sounds kind of silly, but apparently it's something that's really been happening. Kids aren't brushing their teeth correctly, and therefore it's leading to them having really bad teeth, and they're missing out on school, and it's just hurting their academic performance. So, according to the Institute for Career Research, the dental hygienist's origin can be traced back to the mid-19th century, coinciding with the evolution of the oral hygiene movement in dentistry. It was around this time that the dentists began to recognize the importance in providing preventative care for their patients. So it's been going on for quite a while. Also, according to the Institute for Career Research, dental hygienists obtain, evaluate, and monitor the dental medical histories of their patients. They thoroughly examine teeth and oral structures and clean and polish their patients' teeth. This involves removing the calculus, stains, deposits, and plaque from above and below the gum line. Dental hygienists also process and interpret x-rays, take impressions, and apply cavity preventive agents such as fluoride and pit fissure sealants. So this is a little child that we need to just teach. This is about the age of my son. So I'm learning how to teach him how to brush his teeth now. So it starts when they're really little. He's about 16 months old. So then when they're about this age, they have this outlook that they want to go to the dentist and they enjoy it, so that they don't have cavities like the first picture that I showed you. So they need to have regular checkups. That's something that we teach the kids, so that they know that they're supposed to be coming every 6 months to get their teeth cleaned. So they go home, they brush their teeth twice a day, morning and night, and then they also need to be flossing too. That's something that I think a lot of people really miss, is to floss every day. That way that you your brushing gets the outside and inner surfaces, but when you floss, it kind of gets the in between the teeth that brushing really doesn't get to. So, according to Vijay S. Kumar, around 43.4% of children have experienced a toothache often in the past 3 months due to oral health problems, and 45.6% of children have missed school in the same period. And according to Sonia Dina, studies show almost 30% of all caries affecting deciduous dentation, temporary teeth have a thinner and much porous enamel than permanent teeth. Children's unhealthy habits are bringing forward to enamel demineralization. So when I graduated high school in 2009, I had a hunch that this is something that I wanted to do with my life. I always enjoyed going to get my teeth cleaned. A lot of people don't enjoy going to the dentist, but that is something that I really enjoyed. I never had a lot of cavities, so maybe that's why I enjoyed it more. I think if you have more problems, that kind of gives you a bad vision of going to the dentist. But that's why I chose this career. So I've been going to school and working full time for almost 9 years and trying to get to this point. So I'm applying and getting it done. Hopefully I get in and I'll start in August. So I chose this career path for all the positive aspects of the job, so I can help people and educate patients how to clean their teeth properly and possibly help children's academic performance. I know that by hearing other dental hygienists speak to me has helped me be a more informed student and patient. To better my own oral health, have I helped you? Thank you.